Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today I'm going to be doing a slideshow presentation and providing information on duloxetine. Its brand name is Cymbalta. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So first off, what will we cover in this slideshow presentation? So first we're going to talk about how this medication works. We're going to talk about indications or reason this medication would be prescribed. We're going to talk about contraindications or reasons people would not be able to use this medication, touch on dosing, and then follow it up with side effects with percentages. So first of all, how does duloxetine or Cymbalta work? So it's a selective serotonin and norepinephrine reuptake inhibitor. It potentiates the serotonergic and noradrenergic activity in the central nervous system. So when would we see this medication be prescribed to patients? We often see it used in major depressive disorder, or MDD. Duloxetine can be used to treat chronic musculoskeletal pain. We see it prescribed in the setting of fibromyalgia. Diabetic peripheral neuropathy is sometimes treated with duloxetine or Cymbalta. And finally, we also see it used in generalized anxiety disorder. Now, what are some reasons that this medication would not be able to be used by an individual? So the first one here is obvious, which would be a hypersensitivity or allergy to duloxetine or any other component of the product. And then also, this medication would not be able to be used by patients who have used a monoamine oxidase inhibitor within the last 14 days. And this is due to an increased risk of developing serotonin syndrome. Now, what about some examples of dosing of duloxetine? So in major depressive disorder, we may see 20 milligrams given twice daily, or up to 60 milligrams daily, divided in 30 milligrams, given as 2 doses initially. And then we may see a maintenance therapy between 60 milligrams daily and 120 milligrams daily. Again, this could be divided in 2 daily doses. In diabetic peripheral neuropathy, we would typically see 60 milligrams once daily. And in generalized anxiety disorder, we may see 60 milligrams once daily, or some patients may start with 30 milligrams once daily for the first week, and the maximum dose would be 120 milligrams daily. Now let's wrap things up here with some side effects of duloxetine or Cymbalta. So first we see in up to 6% of patients diaphoresis or profuse sweating. We see constipation come in between 9 and 10% of the time. A decrease in appetite may happen between 6 and 10% of the time. 6 to 9% of patients may develop diarrhea, and 18 to 23% may experience nausea. 11 to 14% may experience xerostomia, or dry mouth. Asthenia, or abnormal weakness, is a possibility. 8 to 9% may experience dizziness, and a headache may occur in 13 to 18% of patients. Some patients may experience hypersomnia, or insomnia. Insomnia happening between 7 and 10% of the time. Some patients may feel sedated. They may experience somnolence or fatigue. Now, some more serious side effects that may happen with duloxetine would be a hypertensive crisis, referring to high blood pressure, orthostatic hypotension, which would be a sudden drop in blood pressure when going from a seated to a standing position, hyponatremia, or low sodium levels, suicidal thoughts, or serotonin syndrome. That's all we're going to talk about today in this brief presentation giving information on duloxetine or Cymbalta. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. For today, take care.